let's talk about different ways to nurse. I am no expert, but I am nursing my third baby, and I've seen a bunch of lactation consultants along the way. I haven't talked about this really at all in here, but my first two kids both had tongue and lip ties, so like that's a whole different thing. Here in this comment, she's asking about like switching sides and kind of the mechanism on how to do that. So I will explain exactly what I do and what I was taught to do. In the hospital, like right after you have your baby, you are supposed to kind of nurse on both sides equal amount of time. That being said, you do need to start on alternating breasts. So when you nurse at 12 p.m., you start on your right, and when you nurse again at 2 p.m., you start on your left. When you first start nursing, it is just really about developing your supply. Like you have colostrum and it's like nothing's coming out except just like a tiny teaspoons of that. But it's teaching your breasts on like how much it needs to do in the letdown. And if you're only nursing on your right to start every single time, it's going to impact your supply. So as your milk comes in, it changes a little bit. Then you're taught to fully nurse on one side and then end like a couple minutes on the other. So the concept is really like, I think somebody referred to it one time as like dinner and dessert. So let's say it's a 6 p.m. feeding. I'm starting on my right breast. I feed for 25 minutes. It takes 25 minutes to fully empty that breast. And then I switch sides if the baby's still hungry, and she might only nurse for like 5 or 10 minutes on the other side. And then for your next feeding at 8 p.m. or 9 p.m., you're going to start on the left side. So fully feed for like that 25 minutes on the left for dinner, and then dessert on the right breast. So I actually kind of misspoke in my original video. I will, in the middle of the night, I'll nurse on one side, switch to the other, and then I'll usually lay my burp cloth on that side. So when I wake up for my next feed, I know, okay, I have to start on that side now. It sounds so much more complicated than it is, and I swear when you get into it, it becomes more rhythmic and normal feeling. Like I said, I'm just a mom with some tatas that I've done this now 3 times. So there's other ways to do it that are equally as effective. At the end of the day, breastfeeding is like both hard and easy at the same time. Amazing what women's bodies can do.